Now we've got Hannah Moore and Jeff Harmon, who are physical therapists at OrthoCarolina, and they're going to walk us through some of the rehabilitation and prevention of foot and ankle injuries. So Hannah, why don't you tell us what to do?
Yeah, so a couple of the common injuries we see, one of them would be ankle sprains. That's something that occurs when someone rolls their ankle, whether inward or outward. And what happens is those ligaments that connect all the bones together in your foot can either get stretched out or torn in that injury. So patients can expect things to be painful, swollen, sometimes bruised, and they can have some difficulty walking. And in that case, we encourage people, if it's a very difficult time to walk, to, of course, go and get checked out by a medical provider, maybe get some images, some x-rays, and make sure there's no fracture. And then after that, they can kind of begin weight bearing is tolerated. Um, Walking with like an assistive device if needed, a crutch or something like that. And of course, use the RICE principles for swelling and pain. So that just stands for rest, ice, compression, and elevation. And then we have some strengthening exercises that we recommend, as well as some balance training. And that just encourages the ankle to heal, to get out of that inflammatory period, and then get stronger and more stable. And if they continue to have ankle sprains, someone that with like chronic instability or recurrent sprains, we suggest using some sort of brace just to kind of supplement that stability.
One of the big things that happens with these is with any type of injury, we end up losing a little bit of strength around that area. So one of the first things we do after we reestablish some normal range of motion is to get those small stabilizing muscles working a little bit more efficiently, which allow us to counteract that weakness now that those ligaments have been stretched. So that's one of the big things that happens with our gait. We lose a little bit of that stability, and that's why it always feels like we're going to get some another rolling episode or something to that effect. So that's why the biggest thing we can do is get a lot of that strength back in through there. Another area that we need to work on after we get some of that strength back in, reestablish that range of motion and get that swelling control, is if we can get that balance aspect of it as well. So the big fancy term is proprioception, which just means where we are in space. So our foot has to hit the ground, and we have to be able to react to changes in topography in the ground itself, or if we happen to misstep, if we're wearing flip-flops and our heel comes off the edge of that flip-flop, if we don't have that proprioception, we end up rolling that ankle again, which could lead to further injury or even cause the initial injury itself.
Okay.
But we'll run through a couple of different exercises to begin that strengthening phase, if you will.
Yeah, we have a couple of exercises we can show you. One easy ankle strengthening exercise we do is a resistance band exercise in which we work the muscles on every side of the ankle. So I'm going to kind of walk you through 4 directions that you can do with this band. So the first direction would be just to point straight down. So straight up and down. And you could feel that kind of work in the calves and the muscles on the back. The second direction would be to go straight up. So I usually have the patient bring his other foot up, hook it around that foot as an anchor, and then just pull upwards towards the tension. So you had downward, and now you have pulling upwards. Okay. And then you can stay in this position for the third exercise and just let the foot fall inward towards the tension and then bring it outward away from the tension. Now you're working the muscles on the outside. And then the last one, you're going to cross that leg over, keep the band hooked, anchor it around your opposite foot, and now bring the foot inward. So you did all 4 directions, down, up, out, and in. You've covered all the muscles and tendons that surround the ankle. Now, I would recommend doing this a couple times a week, 3 to 4 times a week. You can adjust the resistance depending on how tight you pull the band. And typically a good number of set and reps would be about 2 to 3 sets of 15. So one way to work on balance training to incorporate more stability exercises is to do single leg balance. So you may want to get with a therapist first to determine if this is appropriate for you at home and if it's safe. but typically for our younger athletes, this is something they can handle. So just working on standing statically, keeping your balance on one leg. Now, if that becomes easy, a progression would be to put something soft underneath your foot and make the surface more compliant, which would challenge stability. Now, most people don't have a foam Airex pad at home like we use in here. So something easy you can use is a throw pillow off your couch or one off of your bed. And that'll make the ankle kind of have to waver a little bit more and challenge the stability there with having a soft surface. And you can do this for time, kind of practice for somewhere between 30 seconds and a minute. You could even make this challenge, a little more challenging by adding a dual task, something like throwing and catching a ball, either from yourself to another person or just between yourself, just kind of like up and down in front of you.
Then another classic ankle injury is a overuse injury, Achilles tendonitis. It happens a lot when it's not a aha moment when we have that injury. It's more of, oh, hey, I've started to have a little bit of pain, and then, oh, it'll go away, and it continues to get a little bit more, and then 6 months down the road, you go, oh, wow, my ankle in the back of it really, really, really hurts. It's just that overuse that we continue to do, because every time that we go into a toe off position, when we walk, we fire that calf muscle, and the Achilles tendon is what attaches our calf to the bottom of our heel. So we just get a lot of irritation in through there, and it just sits around and just festers for quite a bit of time. And it can be a pretty uncomfortable sort of injury.
So one of the best ways to treat Achilles tendonitis is by doing eccentric heel raises. And that's a fancy way to say focus on the lowering down portion of your heel raise. So you can do heel raises multiple different ways. You can do them on a calf raise machine at the gym. You can do them standing on the edge of a step on a staircase, or you can do them on a leg press with your knees extended, just focusing on the ankle movement. The evidence says that you should do these at a very heavy load and at a slow speed. So every time you lower down, we recommend it take about 5 seconds or so to lower down. And you can do these a couple times a week, 2 to 3 times a week, about 3 to 4 sets of 15 reps. We can demonstrate that now if you'd like.
For eccentric raise, you'll go up on both feet, then you'll take your injured one and then slowly come back down to the ground. So it's both feet up. That way you decrease all the force going through the injured side, and you split it, and then you control it on the way down so that that's your eccentric loading positioning through there. So this is probably the easiest one to do because you can just use a kitchen countertop versus having to have a step, or as Hannah was saying, also the calf raise machine at the gym. So as long as you have a surface that won't slide away from you if you put that pressure down, you'll be in good shape with this one. And then you can also do it with the band like we previously demonstrated with the ankle sprain, where if you put it around here and you have your anchor point and then you come up against the resistance and then it's controlling back down, you can even see I have a little bit of a shake as I come down because I'm trying to eccentrically control myself, and I don't have the greatest, it appears. So apparently I need to work on this a little bit myself. So that's another easy way we can get some eccentric loading in through that tissue.
Right. So in addition to strengthening the Achilles tendon, you do want to stretch it as well. So this is a calf stretch. I'm stretching my back leg. My knee is straight and I'm lunging forward till I feel that stretch in the calf. So stretches should typically be held for at least 30 seconds. If you hold it longer, that would be great. And doing a couple of repetitions would be good as well. Now, you'll want to stretch the calf as I am now, but there are 2 muscles that make up the calf muscle. The first one is the gastroc. That's what I'm stretching right now. And the second one is the soleus, which you have to stretch by slightly bending that back knee. So you're going to feel that stretch a little bit deeper towards that Achilles tendon heel area, okay? So you'll want to do a couple stretches with the knee straight, as well as a couple stretches with the back knee bent.
All right, before we move on, I want to remind everybody that they can put their questions in the chat, and in a couple of minutes we'll do question and answer with our physical therapist and Dr. Ellington. But the next thing we want to talk about is plantar fasciitis, another common injury. Hannah, tell us about that and some of the treatments that go with it.
Sure. So plantar fasciitis is inflammation of the fascia that's in the arch or the sole of your foot. It connects your heel bone to your big toe. And that just occurs over time, either from poor shoe attire or sometimes increased body mass index, so overweight. It's pretty common that we see most people complain about the first steps in the morning are the most painful, getting out of bed. So things we do to work on plantar fasciitis would be like massage to the area. We have therapists will do that for the patient, or we teach the patient how to do it themselves with like a lacrosse ball or a tennis ball, or even a frozen bottle of water. All of those are great ways to kind of roll out the sole of your foot on some kind of firm structure to massage the area. In addition to that, we recommend seeking out orthotics, whether they are prefabricated, meaning like off the shelf, or custom. We recommend night splints, which is something that they can sleep in, so those first steps in the morning aren't quite as painful. And then we teach them some stretches, like previously shown for the Achilles tendonitis, the gastroc and the soleus stretches, the two calf stretches. And we encourage shoe rotation, especially for those that are on their feet all day long. You don't want to wear the same shoes every single day because this is a overuse or repetitious injury. So you want to expose your foot to different stresses throughout the day or throughout the week, so you don't keep going through the same motion and keep re-irritating that plantar fasciitis. So finding a shoe that's supportive is important, but also maybe kind of switching it up throughout the day if you're someone who works constantly on your feet.
Here's a question for you, Ann. I don't have a lot of experience with it. And what do you think about high heel shoes? Is that an option or no?
Well, us ladies love them, but it definitely puts your plantar fascia in a shortened position. So adequate dorsiflexion, which is that toe up motion, is needed to de-stress or take some of the stress off of the plantar fascia. And the high heels are going to make you very tight, unfortunately.
One of the things that we like to teach patients is just taking a run-of-the-mill tennis ball. It can be a lacrosse ball, a baseball, softball, something that's got a little bit of diameter and a little bit of mass to it. But you don't want to use a golf ball. It's too small. It's too hard. It's really uncomfortable. And then what you'll do is you'll start by putting a little bit of downward pressure onto the ball towards the heel, which is one of the areas that the plantar fascia attaches. And then you'll just roll it all the way up towards your big toe, and then just rinse and repeat. Now, if you don't have one of those balls, you can always freeze a bottle of water and use the same exact method as well. So you'll just go from heel all the way up towards that toe. And that helps to stretch that area out. So, and you can do this for several minutes at a time. It doesn't have to be a 30-second or a minute. You can just roll through an entire commercial break if you're watching a television show, which usually is 2 to 3 minutes or something. So you can do that several times a day, even if you'd like to. It just really helps to break up that soft tissue that's really started to knock down quite a bit.
So plantar fasciitis, you'll use the same stretches, the gastroc and the soleus stretches I previously demonstrated for Achilles tendonitis. But one extra component you can add to your stretch is take maybe a roll of towels. You guys may not have a half foam roll like we do here, but take something just to kind of extend that toe a little bit more, and that will really pull through the entire plantar fascia because you're stretching it across all joints that it attaches to. So instead of having your foot flat, you're going to have your toes a little bit extended into a stretch, and then just lunge forward like a normal calf stretch. And that just stretches it a little more intensely.
All right, very good, you guys. Thanks for that update.